Well, hello and welcome to Rajat TV. You're watching India Fights Back with the host Rajat Kain. With the COVID-19 vaccine now seemingly just round the corner, perhaps after go-ahead from the scientist, the vaccine literacy is essential to build public trust in the vaccine, says health experts. Now, this should be supplemented with aggressive testing and tracing strategies until the public trust on the vaccine is sufficiently built. What we require is a communication that is must for imparting information as well as addressing any vaccine hesitancy, beg your pardon, by building confidence amongst the resist group. The strategy also includes measure to mitigate unintended crisis situation if it occurs at all. So how important is to sustain a correct communication about the vaccine besides getting in place the logistics? To discuss further on this very important issue, we are joined with a panel of three eminent guests. Dr. Samiran Panda, he is scientist and head ECD division of ICMR. Professor Rakesh Aggarwal, he is director of JIPMER Puducherry, and Professor Narendra Kumar Arora, he is executive director, the INCLEN Trust. Well, many thanks for all of you to join us. Let me begin with you, Professor Rakesh Aggarwal. Vaccine, of course, will arrive once we get go-ahead from the medical or the scientist fraternity. But what is important here is to have a correct communication about it. Sir, do we usually see a communication gap whenever new thing of such a scale arrives among public?
There is always a need for communication whenever we talk about any medical procedure or intervention. Usually that happens between a doctor and an individual when a person visits a doctor, whether it is for a vaccination, for a diagnostic test, or for that matter for drug treatment or any symptom. In this case, because we are doing a community intervention, we are going to do something for a large number of people. So it is important that we have communication on a larger scale. Communication is an integral part of medicine and medical procedures. So medicine and communication are just inseparable.
Well, thanks for your opening remarks and a pretty good point, right? Analogy you pointed out that at a micro scale, it's obviously communication between the doctor and the patient. Dr. Samiran Panda, how important is communication here? For that matter, good communication strategy given the scale is fairly gigantic. It's not about one individual with a doctor. It's basically about a group of doctors or medical workers going on a mass vaccination. So,
well, communication is always very challenging, an issue, be it at the individual level, one-on-one, or one-to-many, or even a group to the community, or even within the community groups. I will elaborate. For a communication, you need an environment. But the environment today, in today's world, is such that you have a lot of smokes or smoke screens. Somebody said very interestingly, the syndrome of FOMO, F-O-M-O, fear of missing out something. So at the individual level, maybe I'm missing out something that my friends know. So from there, we all jump onto the social media, and there are not only right information or good information, but there are a whole lot of misinformation as well. So that's what I want to first of all highlight. Secondly, as Dr. Aggarwal very rightly said, physicians, nurses, healthcare workers, they have always been involved in one-on-one communication with the patient for whom they offer care. But then the patient or the patient party also receives information from the communities or community groups. So how does one see the communications that is happening and the information that are getting exchanged are in sync with each other or are in conflict? So the most important issue, public health issue or public health perspective, would be to have a very transparent communication mechanism in place so long the government is concerned. On the other hand, we need to always check out whether the information that I'm getting or the information that I'm ready to forward, because today we live in a world of forwarding messages. I mean, I'm sure that all of us have experienced this. Before forwarding, I should be ensuring that am I forwarding the right thing? How authentic is the information that I'm going to forward? So all these are very important for us because that is an essential component of the responsible communication. So what all I try to underline is not just information, not just communication, but an environment where we check it out, the authenticity of an information, and how do I pass it on if I'm doing it from a group to another group. This is an age or era of social media, and for the government, government is always doing it very meticulously, trying to dispel the myths and the misconceptions.
Right. Well, many thanks, Dr. Samiran Panda. We'll come back to you. Dr. Arora, whenever such an exercise is in place, what sort of training modules are expected for the medical officers or the vaccinating officers, and also like the chain handlers, supervisors, data managers, and of course like the community workers, do we say so?
So I think both Dr. Aggarwal and Dr. Samiran Panda have laid out a very important framework for communication. I would like to add 2 or 3 additional dimensions.
Sure, sir.
One is that we are living in an environment today, COVID environment, where for the first time, such a large number of adults are going to be immunized. So far, immunization was considered only for children. So communication was indirect. So I was communicating with parents about the benefit for the child. Here I am talking about communication directly to the recipient. So that is one dimension. The second is there are 2 expectations. There is eagerness for vaccine. So right from the day one when pandemic took over the world, everybody was saying, when will the vaccine come? And the second dimension is that over the time there are concerns whether vaccine is right, so much in such a short period, how can vaccine come? So all these aspects of communication has to be taken care of. And we need to use all the channels possible to communicate and create that ecosystem. So whether I'm talking about one-to-one communication, what we call as interpersonal communication. So when somebody is sitting in front of me, expecting the vaccine jab from me, I need to communicate in a very structured manner which is transparent and unambiguous. Similarly, all around me, I should get messages and true picture. In fact, the word today used is exceptional transparency. So there is total transparency, and it is also perceived to be transparent and that nothing is being hidden. And the third thing is that if there are concerns or whatever concerns it get into our ears, they are taken care of proactively. We do not go into a reactive form, but we proactively take care of the concerns also. And as new concerns arise regarding vaccine, we take care on a ongoing rolling basis.
Yeah, that's right, Dr. Arora. So that's very important point you raised. Let me just go off to Professor Aggarwal here. Sir, given the pandemic and given the extent of it, now, is it for the first time that we are drawn in a situation that communication of this level is required? I mean, especially that we have other channels of communication which perhaps may not give the right communication. Say, for instance, we have social media here. I know it's a question about the communication and less of technicality, but given the vaccine, you think this perhaps could be one of the challenging aspects in the mass vaccination drive?
So I don't think it is challenging. Everything in life is challenging, but if you have the right messages, they can be spread. On the one hand, social media may seem like a challenge and a problem, but on the other side, it can be a force multiplier.
Right.
We can use social media to spread message very quickly. We can use social media to inform people. And this is not the first time we are doing this. We have
Yeah,
had
yeah.
Mr. Amitabh Bachchan appearing on the TV and also through short clips which are going around on social media for polio vaccination. Several years ago, he talks about testing when you have cough for a long duration. All those messages have been used on social media previously also. When we had Nipah virus outbreak, there was no vaccine there, but we still used messages and we used social media for spreading information. We use social media for spreading information about COVID and non-pharmacological measures. For instance, for using masks, for social distancing, or physical distancing, for hand washing. Social media has been a boon to us. We
Yeah.
could not have used these measures so effectively if the social media had not been there. So to
Okay.
me, every coin has two sides. There is a black side, there is a white side. We have used in COVID social media very usefully, and I'm sure we will be able to do that even for vaccine.
So let me just ask, yeah, the social media is very important tool, and of course, like, yeah, in this fight against COVID, social media, of course, has been used extensively by the authorities, by the health workers, so as to get the right message. Dr. Panda, like in a situation where we have both the hesitancy as well as eagerness, what becomes the most challenging bit? There is, of course, eagerness for the vaccine, and of course, I mean, perhaps maybe hesitancy amongst certain groups as to whether they want this vaccination at all. I'll come back to this question of whether all of us needs vaccination, but later. But here, I mean, this fight between eagerness and hesitancy, how does that needs to be addressed?
Okay, this is a very important question. Of course, if you talk about hesitancy, the other side of it is readiness. And the readiness could be considered at the individual level or at the social level. And we are, of course, talking about a public health intervention here. So only one individual's readiness or one individual's hesitancy won't matter because we do not live in isolation. We do live in groups. And there is a term called peer influence. So we do talk with each other and try to form an idea around an intervention. And here we are talking about vaccine. On the other hand, there is a term called trust. If I have trust on the existing healthcare system, machinery, and the governance that regulates it, that actually opens up my mind to a suggestion that might come from, or that is going to come from the government healthcare system. But if I lack that trust, naturally there will be resistance. So it's an interaction of not believing in vaccine or believing in a vaccine. It's a complex phenomenon where I consider my health or take my health into consideration. I also think that, all right, maybe the vaccine is not that much necessary. What would happen? My neighbor got COVID and came out all right. So there is not much risk. So this health risk balance, trust and mistrust with the government machinery and the system, and then readiness or hesitancy. All these interplay for acceptance of a vaccine. So listening to the community and engaging the community would be so very important. If we really want to understand all these dimensions, that would determine what would be the uptake of vaccine at a mass scale or at a population level.
Right. Dr. Arora, you just mentioned about the transparency in the communication and the systematic implementation of communication activities. Now, here it becomes important to understand the other aspect of it. I mean, yes, it's perhaps like an operation where we want everything to go right, but what are the risk factors towards it, or any adverse situation that may arise out of any big medical operation, to say of?
First of all, I would like to put on record that India has an excellent learning experience.
Okay,
In
right.
last 25 years,
Mm-hmm.
we have learned from polio program
Mm,
first, and subsequently measles and rubella campaign also we learned.
right. Mm-hmm.
But equally important is that we learned how to overcome these challenges, communication challenges. And one of the important thing which we have learned is that communication has to be a very dynamic process,
Mm,
and refinement and realignment with what the community is expecting. As
mm-hmm.
Samiran said, that community engagement. So we have to
Mm,
have listening post. Our ears have to be on the ground at all the times.
right.
And
Right.
therefore, when we are talking about social media or press or even what people are talking among themselves, there has to be a listening post mechanism.
Mm-hmm.
And there are now scientific ways of listening to social media as well as press and others also. And so that is one very important component. And
Mm,
will that will form the architecture of our communication, both
right. Right.
proactively, that is promoting acceptance, and also seeing what are the possible factors or barriers which may prevent or which may generate suspicion or concern or issues of confidence and trust come in. The
Mm,
second thing is, which is very important, and which is India is fortunate that in India, vaccine hesitancy is not such a major issue
okay.
as we hear it from a lot of high income and Western economies and high income communities.
Any
It is
particular reason
there.
for that, sir? I'm sorry to interject here, but any particular reason why the vaccine hesitancy, as you mentioned, in India is far lesser than the other countries of a group you mentioned?
Think it is a cultural issue, I very strongly feel. We say
Mm,
prevention is better than cure. It is embedded into
mm,
our philosophy. Whether we go by Ayurvedic system, by we go the other systems, we always talk of prevention. Even today, when we are saying boost your immunity to prevent infection, so
mm,
that prevention is very much part of our cultural ethos. As a
okay.
result, whatever is prevention, and that is takes care of it. Second is, I think the national experience with pediatric immunization, routine immunization program has been outstanding.
Mm-hmm.
That huge number of children have been kind of saved from almost sure mortality, and particularly in low income settings or
Okay.
poor rural backgrounds. As a result, people do value. So today, a lot of mothers, even educated mothers, may not know for what a particular vaccine is there, but they know that it is like a insurance for their child. So taking clue from there, we I think that we should build on that cultural ethos,
Okay.
that prevention is better and immunization is an insurance or prevention against a particular disease. And here it is a very bad pandemic disease. So
Mm,
that is one issue on which we have to build our communication, reinforce it. There are certain population groups which have many other reasons other than the vaccine itself, which we call that religious, political, geopolitical, and basic concern or trust with the public system. There, we
mm,
have also learned from polio that if we do the right strategy, we use the right stakeholders, influencers, we are able to take care of those concerns pretty
okay.
well.
Right, right, right. Uh, Professor Aggarwal, let me ask a very technical question here, more on the technical side, and that is not based only on the mass vaccination for COVID. Now, whenever any new medicine is administered to public at large, what are the factors that the medical fraternity looks for to have a feedback and perhaps to avoid any adverse situation?
That's a very nice question. The, the process starts much earlier when the drug becomes available.
Mm-hmm.
Science starts from trying to try it in a cell culture in animal model, whether it causes any side effects. And if anything is noticed, the drug does not progress into humans at all. Provided it passes that stage, then we have a phase 1 trial when you give
Right.
drug or vaccine to only a few people, maybe even 30, 40, 50, sometimes maybe 100. And even there, to first give it to 5 or 7 and then give it to a larger number, closely watching them in a facility and seeing that nothing happens and their blood tests are done. In animals, you follow them for years, and then there is in humans, after a phase 1 study, you do a phase 2 study, phase 3 study, and you follow those people very closely.
Okay.
Surely, as we have seen with COVID vaccines, some people do develop adverse events in the period after they have got the vaccine. But remember, in these trials, half the people get the active vaccine, half the people get something which is just nothing but salt water, saline, or another vaccine which is well in use. So, if you take any group of 30,000 people, some people will have some illness in the next few days. So that can happen with vaccine too. So what is looked at is, if you had 30,000 people, 15,000 got the vaccine, 15,000 got the other thing, you compare whether the rates are any different in the two groups. If 2 people here had something and 2 people had something in the other group, or maybe 2 or 3 in each group, then you can say that the vaccine is safe. So all that happens earlier. Also in trials, patients are followed for a long, people, not patients, for vaccines, people who have got the vaccine, they are followed for several months, maybe a year, to see that nothing happens. The only thing we are doing with COVID vaccines is we are looking at this only up to about 2 months after vaccine administration. But then we know that with vaccines, side effects most of the times occur within the first 6 weeks, and hardly any side effects occur after that. And that's what we have done by having these trials go on for 2 months. Secondly, there can be sometimes differences in different populations. So we are making sure that only vaccines that have undergone trials in India are used in India. So that's one of the important things that the drug regulator is trying to do.
Right.
So by doing this, we minimize the chance that something will come up for the first time after the vaccine is starting to be given in a more liberal manner. Again, these are not being approved as totally open approval. They are going to be given as early use authorization. So people who are given the vaccine, the doctor or the health workers will observe them for, say, half an hour after the vaccine is given, so that if something happens, it can be taken care of. The medical teams that will give the vaccine are being prepared with what are the potential things that can happen, and they would be ready for this. And there would be a backup available in hospitals just in case something happens. But that's more like a backup arrangement rather than something that we really expect to happen.
Okay.
Also, please remember, and I think through you, because viewers are watching this program, I would wish to convey that everything that happens after a vaccine is given is not necessarily related to vaccine. For instance, it's entirely possible that I'm sitting on your TV program and talking, and I could have a heart attack right at this time. That's well known. After all, I'm near 60, so that could happen. Same way, it could happen in a place where a vaccine is given. So what needs to be seen is whether this happens more frequently in those who get vaccine than what happens in the general population. For all this, systems are being set up, systems are already in place to some extent, and that is what needs to be done. If such event happens, don't need to panic. We still need to follow up. There are ways to ascribe whether this is because of vaccine or not, and we have sufficient experience in this, at least in children. For adults, it can also be done, and it's being done. So I think the most important thing is to know that these vaccines have been tried in several thousand people and have proven safe, and only then, even for emergency use authorization, we are permitting these out. Again, there is close vigilance in place, and if at any stage anything happens, we will go back to drawing board, but most likely, knowing what we know already, that's not going to be needed. Finally, I do want to convey a message. There is a hesitancy for everything in life. Any one of us who got into a flight for the first time, I'm sure had a bit of palpitations. When computers came in, many of us, I know my father for the first time when he looked at a computer said, I hope it won't give me electrocution, right? For everything, even cell phones came in. A lot of people had a whole lot of hesitation using cell phones. So this is
Right,
not only
right.
food. Any new food we see, we are much more hesitant. Okay.
Absolutely.
So when it comes to food, drugs, vaccine, hesitation is slightly more, but hesitation is there in everything of life. I think it's a protective mechanism nature has built into us. A child, if it touches anything, he first touches it a little bit to see that it's not warm, it's not something that's going to hurt him. Hesitancy is a built-in protection mechanism. If
Right,
we
right.
understand that, I think we would be much better off.
Right, right. Professor Aggarwal, many thanks for your thought and very important point that you just elucidated that it's very important for the government to convey, or for that matter, for the machinery to convey not just how important is vaccination, but also the process it has been followed before this vaccination drive is there on the ground. Last word, Dr. Samiran Panda from ICMR. Is it really important for each and every one of us to have the vaccination, or is it be for certain group to begin with? Sir, just very briefly, we're just short of time, sir.
Quickly, the virus is in search of individuals whom it can infect and in whom it can proliferate. So if the vaccinations happen in certain critical masses where the virus doesn't get a new body to infect and proliferate, then the chain of transmission stops. So it's not necessary really for each and every Indian to be vaccinated for stopping this transmission. So I would say the critical groups and a critical number of people, if they get vaccinated, the chain of transmission will stop. That's what the biology of the vaccine and the disease tells us. But that is not to indicate that we can lower our behavioral protective guards down.
Right.
Together, we will win.
Right. Well, many thanks, Dr. Samiran Panda, Professor Rakesh Aggarwal, and Professor Narendra Kumar Arora for telling us about the right communication, of course, how important this becomes along with the logistics so as to stave off any apprehension when the mass vaccination program is rolled out. Well, many thanks to our viewers for joining us. But before we leave, here is a small appeal by RSTV to all of you. Please follow COVID-appropriate behavior. Keep washing your hands, maintain physical distance, and of course, keep wearing a mask. These three are small little things that's all required to defeat and control this pandemic. Well, many thanks for watching this edition of India Fights Back. Keep watching Rajat TV for more. Thank you.